And I welcome you all to our special dialogue series. Savlon Swasth India Mission presents Hygiene Sahi to Health Sahi, partnered by Times Network. The pandemic has brought into sharp focus the fact that collective health of the nation is rooted in everyday citizens taking responsibility for their individual hygiene, in the absence of which communicable diseases can run rampant to the detriment of the community. In this episode, we will decode the burden of communicable diseases on the society at large. I am in conversation with a highly distinguished panel. Allow me to introduce our guests. Dr. Chandi Abraham, Head at ITC Healthcare. Dr. Subramaniam Swaminathan, who is the Director, Infectious Diseases at Gleneagles Global Health City, Chennai. Dr. Sunila Garg is also with us, who is Director, Professor and Head at Department of Community Medicine at Maulana Azad Medical College, New Delhi. And we have with us Dr. Gagandeep Kang, who is the Professor, Microbiology, Christian Medical College at Vellore. Thank you so much to all of you for joining us into this conversation. And I would like to start by asking Dr. Swaminathan first. So the coronavirus-led pandemic seems to have become a never-ending cycle with the emergence of Omicron and now Demicron. Any thoughts, sir, on what lies ahead and what measures must one take in this scenario with reference to travel, self-protection and assessing symptoms?
Basically, Omicron will probably take over as the alpha dog in the world as far as COVID is concerned. For it to be dethroned and another one to take over is probably a big challenge given how aggressively communicable it is. So I think it's safe to say that Omicron is probably here to stay for a significant period of time. Finally, what is going to happen as far as COVID is concerned? Simply put, the vaccine inequity is a serious issue. As long as the majority of the world has very little access to vaccine and a large population of the world remains relatively unvaccinated, I think it's going to be a problem. And reassortment and development of new variants and things like that is a foregone conclusion. And therefore, I think this needs a more organized approach. And what it has basically shown is that our responses to global emergencies like that remain fractured and very hamstrung by regional issues and political requirements.
Dr. Kang, I'll come to you next now. I'm sure the parents who are watching, they would like to know that, how will they and how can they protect their children without forbidding them from their everyday activities like playing outdoors, going to school, and so on?
All of the studies that have included children have shown us that children do get infected, but they do not develop as severe symptoms as adults do, and particularly the elderly and those with comorbidities do. So for parents, I think the best thing we can do is reassure them, tell them that, the precautions that you need to take to send your children out to school are essentially focus on masking, focus on all the non-pharmaceutical interventions that we are aware of. If you're really worried, use a higher quality mask. And when you look at sending children out to play, oh, please do that, because children need to play. And the risks of infection outdoor are very, very, very low.
Okay, ma'am. Dr. Sunila, the communicable diseases remain a major public health threat globally, ma'am. And how would you qualify and classify the current burden of communicable diseases on our communities and country at large?
If I was to talk of in context of children, both when we look at the vaccine preventable diseases and other diseases, they also, have been compromised, and we have got a huge backlog of vaccine preventable diseases also. And this will also lead to increased burden on the healthcare facilities. And we also know that, because of pediatric HIV/AIDS, we may have 10% more increase in burden of childhood mortality as well. And also, you see, we have to somewhere make sure that now with the current burden of Omicron and the dual burden of Delta virus and Omicron, we need to make sure that not only accessibility to treatment, but also, accessibility to diagnostics is also a very challenging issue which needs to be addressed as well.
Very well said, ma'am. Dr. Ibrahim, I'll come to you now. Given the size of our country's population, healthcare infrastructure needs serious rethinking, and that's what ma'am also just mentioned, especially in the context of the growing burden of communicable diseases also is what we saw. Sir, how can we optimize the current healthcare infrastructure, and what's your take on the digital? You think the digital will play a larger role to address issues like this and remote monitoring?
There are two things that you look at when you look at communicable diseases, especially when you see surges. One is the intrinsic resilience of the healthcare system. And this is dependent on the infrastructure that is in place. And infrastructure means not only the hard structures, but the communication structures, your supply chain, how your human resource is in place. All of this matters a great deal. If you look at India, we've had a big problem, and I think the pandemic exposed that a great deal. We have about 5 beds per 10,000 against the WHO requirement for 30. On an average, if you take it across the world, it's about 29 beds per 10,000 population. If you look at our doctors' numbers, again, we are quite low. We are about 8 per 10,000. If you look at some of the other countries like the UK, it's about 58 doctors per 10,000 population. So we have already a problem in terms of what is the infrastructure. In addition to that, we have a skew. So if you look at 69% of the beds are in urban areas, which has 35% of the population. So this has caused an incredible skew in terms of the paucity of beds in the rural areas. So how do we get past this? So there is the whole idea of what is called flexible health infrastructure. And this includes things like field hospitals, which of course were set up during this pandemic. Modular units. How do you develop a hospital which has modular units so that you can have the infectious cases managed? The last thing I'd like to say is telehealth is something that can really help to decongest. So I think developing resilience in the system, good planning, and using telehealth judiciously, all of these things can help with infrastructure management.
Very well said, Dr. Ibrahim. And we all saw what happened during the second wave when the health infrastructure came crashing, especially when we were not ready, we were not planned. And the examples that you gave us right now can actually prove to be very, very effective. Dr. Swaminathan, a preventive process can actually be significantly reduce the burden of communicable diseases, sir. And we all know this. Why do you think the general public is yet to adopt this preventive regime as a habit, and what dissuades them, sir, from this?
So if you were to talk about an issue which is something that everybody fears, like say a heart attack or a stroke, people would flock to that particular message. But when you say diarrheal diseases or respiratory diseases, till COVID came along, nobody really paid any attention. Number one. Number two, if you go back nearly 100 years and look at what happened in the Western world, the majority of the gains from reduction of infection disease burden and also mortality happened even before vaccination or anti-infective drugs came out. And the simple answer was sanitation. India is making rapid strides there, and that's where we need to focus. And you know what? The sad part is there is lots to be learned. For example, in COVID, they realized that if you watch the wastewater burden of, say, Omicron, you can actually predict that the Omicron surge is going to happen in that area. So actually studying all of this makes a lot of sense. So what we need to do is basically look at simple, effective measures, which include sanitation, which includes masking, which looks at the ventilation, which looks at reducing overcrowding in certain areas. A lot of these things need to be adopted.
You're absolutely right that Omicron again had to come back and tell us that we had to continue with these habits. Dr. Garg, I'll continue with the similar question to you, ma'am, that habit building is a lengthy process. The doctors have been speaking about it. You all have been talking about it. The burden was more on the doctor fraternity. But ma'am, how do you think the citizens can actually aid in elevating this load?
Being in the field of public health for more than 40 years, I know habit formation is something which is very, very difficult. It has got, cue, craving, response, and finally comes the reward. Not only the doctor's fraternity has to do this, it is actually a 360-degree approach. Something like, I'll take an example of what Dr. Gagandeep said, that, let children go out to play. And what's going to be the reward? Let them sanitize their hands, let them wash their hands. And, somewhere we empower them with correct knowledge. So empowering the communities, number one, sensitizing them about, hand hygiene, masks, and improving the healthcare seeking behavior.
Dr. Ibrahim, health tech is a sector which is driven by innovation, experience and research. With respect to both products and services, sir, what sort of system should be developed to foster innovation in this sector while keeping the patients at the center and with full participation from the healthcare professionals?
When you think of innovation, everyone thinks about products. So the question I ask people is healthcare a product company? Or is healthcare a service company? Everyone says, yes, it's a service company. How much effort do we put into service innovation? You'd find that there are hardly anybody who's looking at service innovations. What are the patient's pain points when they come into the hospital? They have waiting times. Sometimes they don't have complete knowledge of where to go. They don't have knowledge about or transparency about how the billing is going to take place. We need a lot of service innovations that need to come into hospitals, and these should be done inside innovation incubators, sitting inside hospitals. We need to train physicians, nurses, paramedical people on the whole innovation cycle, how to do these innovations, how to look at them, how to develop the innovation funnel, how to actually then prototype and then roll it out. I think this is a huge need, and if we start doing this, you'll find a lot of de novo innovations coming out of our hospitals.
Dr. Kang, I'll come to you now. Ma'am, we all have seen how COVID-19 has changed everything for us, the way we live. With Omicron, the threat into our everyday lifestyle is back with lockdowns, travel bans again re-emerging. Ma'am, in your opinion, is this the right course of action? Or you think is COVID-19 a reality that we all need to live with now? And should the way COVID-19 testing is conducted, we need to re-evaluate that?
The only thing that's special about Omicron is the fact that it's much more transmissible. So if you really want to prevent infection, then you have to be even more careful with the non-pharmaceutical interventions and with ensuring that people are vaccinated than before. And to a large extent, this is the advice that has been given to people. Do travel bans help? Do lockdowns help? I'm afraid I don't think so. Because if you have a virus that can spread asymptomatically and people can be infected and manifest with a positive test 10 days or 2 weeks after they have been infected, then the chances of being able to completely block the virus through a travel ban is near zero. And that's been shown to us with what's been happening with Omicron in India, where we are now finding increasingly cases in people who don't have a travel history. So clearly, whatever we put in place as bans, as a testing strategy didn't work. And the same effectively applies to lockdowns. How long can you lock down for? And what is it that you're trying to prevent? So the way forward, I think, is to think about the fact that there are going to be many more variants that will come. And we need to evolve a strategy for how we are going to deal with them. Now we are at a stage where I think it's much more important to know who's infectious and to know that fast. And if we do that, if we understand that rapid antigen tests are something that give you an answer in 20 minutes and allow you to take out of circulation people who are potentially infectious rather than them giving an RT-PCR test and then sitting at home for a day waiting for the result to come, I think that makes a lot of sense. The other thing to think about is what kind of test. Is nasopharyngeal best, is nasal best, is saliva best? And I think there is emerging evidence that we might need to think about both nasal and salivary testing as easier ways of getting results than doing NPAs all the time.
Yes, ma'am. Dr. Garg, I'll come to you now and I'll go back to the same question of digital healthcare system, ma'am, and how Dr. Ibrahim had also put his point across. I would like to understand from you that, how in the last 2 years, the entire digital health service ecosystem has changed with teleconsultation, online pharmacies, and electronic health records are also now the new normal for all of us. Ma'am, how can the healthcare infrastructure be made more robust, according to you, to help reduce the burden of communicable diseases?
With regard to when we talk of COVID-19, we need to look at all the structures which are existing at the primary level, secondary level, tertiary level. They all have to be strengthened. So this system has to be more robust. But then again, digital technology will play a critical role when we are talking in terms of management of the patients at the primary level, because every patient cannot travel. So this is where our teleconsultations between the healthcare providers, like a specialist talking from district level to primary level, will make a very, very, I'll say it will make the diagnosis very strong and rather give confidence also and capacity building to the primary level providers as well.
Okay, ma'am. Okay. Dr. Ibrahim, you are associated with ITC Healthcare, sir. What has been ITC's approach in terms of reducing the burden of communicable diseases?
ITC has a very robust social investments program, which has different components. One is called WASH, which is water, sanitation, and health. They've actually built close to around 38,000 toilets in rural areas. They've also constructed about 2,500 toilets in schools and about 110 community toilets in various parts of India. There's a huge information and education program that is run alongside this to sensitize people, educate them, communicate with them about the importance of using this. So that program is also ongoing. We monitor the data from this, and we've been able to demonstrate a decrease in diarrheal disease in some of the areas where we've been able to roll this out fairly effectively. There's also a program called Swasth Poshan Alap, which actually helps with malnutrition. And this is a very important thing for children because it helps build up their nutritional status, which in turn will prevent some of these communicable diseases from laying hold of them. So there's a sanitation and a nutrition program. In addition to that, there have also been some innovative ideas that have come through the Swasth India mission. And just to tell you a few, one is, they developed, the mission developed a chalk, which the children use on their slate. But inside the chalk, they've included soap granules. So when the kids have a lot of chalk powder on their hands after class, and they go to wash their hands, it actually foams and it becomes like a soap, so that when they wash their hands, they've actually automatically washed their hands with soap. So that's been rolled out in a large number of schools. It's a chalk with soap inside it, and they all use chalk on their slates. We also have a little pouch of hand wash, which is used inside the ID card, and it's got a little opening at the bottom, which they can open, put the soap in their hands when they want to wash their hands. So a lot of these kind of innovations we've been looking at to propagate hand sanitation and health. We're also in the process of rolling out a rural health initiative with secondary and primary care. I think a large part of what we do will be linked into the public health that we deliver through mobile units, through the community health centers in some of the rural parts of India. So there's a significant amount that's currently being done from ITC's social investments program.
Okay, Dr. Kang, in the end, I would like to take your opinion, ma'am, on the need for the boosters and the effectiveness of vaccines, please, given that the recent reports indicate that the AstraZeneca's Covishield is effective for only 3 months, and a national vaccination drive, you all know, is very much underway. How do you believe India will fare, ma'am?
We certainly have no evidence from India that vaccine effectiveness is waning. The vaccine tracker that the Ministry of Health and Family Welfare has on its website, which shows protection against deaths, has been updated up till the end of October, well after the vaccination program started, and seems to show no decrease in the effectiveness of vaccines. It would be useful to have that information for hospitalizations as well. And I hope that we will have it sometime in the near future.
Okay,
where boosters are concerned, the statement of the Prime Minister on precautionary doses, I think, is absolutely correct. The question is which vaccine should we use? And discussions for that are ongoing. It would be great to have Indian data, but in the absence of that, or while we wait for that, we can certainly look at data that has come from other countries. And the COV-BOOST study at least shows us immunogenicity data for people who had originally received 2 doses of the AstraZeneca vaccine. For Covaxin, we'll have to wait.
Okay, thank you so much to all of you for joining us into this conversation. Thank you. And on that note, our special feature, Savlon Swasth India Mission presents Hygiene Sahi to Health Sahi, partnered by Times Network, comes to a close. We trust you found the insight shared of value. Do chime in with your thoughts by staying connected with us on social media using the hashtag Hygiene Sahi to Health Sahi. Thanks for watching.